Good afternoon, guys. Thank you so much for coming to our didactic. You know, it's a beautiful day in New Orleans, so we appreciate you joining us. Can everyone hear me okay? Okay, fantastic. A little louder. I'll try to be a little closer to the microphone. Oh, fantastic. Thanks, Mike C. That's awesome. So what we're here to talk to you about today is about applications of virtual sim in the educational environment. I want to introduce myself and my co-presenters real quick. My name is Chen. I'm from St. Louis University. I'm just going to kind of go down the line and have you guys raise your hands if that's okay. This is Mike Casara. Mike Casara is from North Shore, right? Okay, perfect. Mike Hardy. And then also Tiffany Moato. All right. So the reason why you guys are all probably here at this talk is that back in 2019, there was this crazy little thing that happened, right, called the COVID pandemic. And because of the social distancing involved, there's this explosion, right, in distance education. So in the simulation environment, we went from doing stuff that looked like this to stuff that looked like this, right? And, you know, I want to be clear that virtual simulation absolutely existed prior to the pandemic, and it existed in a wide range of forms. So, and these range from things like interactive virtual patients to augmented reality devices to full virtual reality devices. But during the pandemic, there's absolutely been a resurgence of interest in using virtual simulation to replace educational or patient care experiences that would otherwise be lost due to a lack of opportunity. So even as the pandemic is evolving, and even as we return to our typical educational formats, there will still be valuable applications for virtual simulation, which is probably why you're attending this today. So in this didactic, we focused the most on telesimulation. So telesimulation is defined by using communication technology to provide a simulation education in which educators and learners are geographically separated. And this can take a range of forms. So in this example here, this is an example of telesimulation where you have learners in a physical sim lab environment while a facilitator that is remote observes the learners and provides an observation of their actions and provides a debriefing afterwards. In this particular example, the learners are actually practicing NRP in a rural ED pediatric environment, and the facilitator is an NRP expert from an area far away because they don't have access to NRP expertise at that rural hospital. It can also occur the other way around. So in this example here, the facilitator is physically in the simulation lab, and they are guiding remote learners through a simulation case. The learners are watching through a Zoom environment, and the facilitator is acting like the learner's hands. So he carries out the learner's actions on the mannequin, and he creates the feedback on clinical choices that the learners make. What we are going to focus on is, we're going to focus on telesimulation with no simulation lab at all, which is another viable option. So with here, what you have is you don't have a physical simulation lab, you don't have a physical simulation space. We just use communication technology and auditory and visual cues to guide learners through a simulated clinical scenario. And this will be the focus of our session today. So there are a number of advantages to this type of telesimulation. And I think the biggest is that you remove geographical barriers. And this gives you a lot of opportunities for creativity. When you remove those barriers, you can put together a simulation, for example, featuring interprofessional learners at all sorts of different sites. You can recruit a facilitator from out of the state or a content expert who is far away from you to help you debrief or help you to construct and facilitate the simulation. You can do simulation grand rounds. There's all sorts of opportunities that it opens up. Because you don't need a mannequin and you don't need a simulation space and you may not even need other personnel like a simulation tech, the cost of telesimulation is greatly decreased. So that cost to get started is a lot more viable for a lot of educators and a lot of centers. And in general, I think you get more participants with distance education. You may not get more engaged participants, but you get more participants because there's increased accessibility to those learners. Obviously, there are a number of challenges with the telesimulation environment. So virtual environment distractions, we're all guilty of this. I think we've all seen learners who show up to Zoom meetings where, you know, they're wearing something traditional above the waist and below the waist, who knows what's happening, right? And then they might have their email on in the background. I mean, we're human, our learners are human, this happens, right? But distractions can take away from educational time. There's difficulty with remote assessment in the telesimulation space. As simulation facilitators, we can observe learners' actions, but we cannot observe their thoughts. And we have to be especially mindful of that when we have an environment like this. there's a lack of kinesthetic skill practice or procedural and technical practice in the virtual environment. There's a lack of an immediate hands-on element for the learners. They can't rely on looking at a mannequin for immediate tactile and visual feedback on how their clinical actions are affecting the scenario in front of them. As we talked about before, we may have increased learner accessibility, but you may have decreased learner engagement. And I think it's obvious to all of us by now that a lot of the social cues that exist when we're in person don't exist in the same way when you're in a virtual teaching space. So that changes interactions between learners, that changes interactions between learners and facilitators. And sometimes in the absence of that body language and that eye contact, it can really lead to a change in the debriefing experience and the communication experience that's so integral for effective simulation education. So what we're going to do here, and because this is I think a good compact group, I think what we can do is we can probably all just circle up into one big group, and we'll go through. We want to walk you through the challenges and the opportunities of creating a virtual sim case, kind of from beginning to end. So we're going to have some stations here. We're going to talk about how you can design sim to suit a virtual telesimulation environment, how you can mindfully create a curriculum that makes sense in that space. We're going to talk about effective pre-briefing in the telesimulation environment. We're going to talk about how you can have tips and tricks to increase learner immersion and learner engagement while you're deploying that simulation curriculum. And then we're going to talk about tech tools I can use to facilitate learner discussion and engagement, especially during the debriefing section. Does anyone have any questions about what we're going to do? All right, wonderful. So let's. Do you want to just stand in the middle? What do you want? Okay. Okay. All right, so let's do this. Would you guys mind just kind of like huddling in the middle? We kind of designed this as a workshop. And yesterday when I swung by the room, it was set up as little tables, but I see in the meantime, they set it up for like abstract presentations, so we're all on these chairs. So I figured if everyone just comes to chairs that are closer in the middle, Mike and I will stand in the middle, and we'll just kind of go from there. Oh, we could put some chairs in the middle, yeah, sure. Mm-hmm.